Hey, what's up guys? Welcome to the Movement Center and welcome to the squat series where we systematically break down the shoulders, the mid-back, the hips, and the ankles so that you can squat and move like you mean it. Hey, what's up guys? This is Mitch here from the Movement Center with episode 4, part 2 of the squat series. So we've already taken a look at shoulder range of motion, thoracic spine, hip flexion or the butt wink, and now we're going to get into hip rotation issues, okay? So with this, a lot of issues that we kind of see with this is people will go down to their squat and they kind of run out of room in the hip and they kind of come in, right? So they come down and blip, come down and blip, come like that. So they'll be here and those hips will come in. Or you'll get kind of maybe one side that shifts off to the other because you're missing range on one side, so they'll come down and shift. So this has to do with the capacity of the hip to kind of go in and out in the socket itself. So what we're going to do is a test. So our retest for this guy is going to be on your back, hip up like this, and you want to check your hip internal and external rotation. So I'm going to flip over this way so you guys can get a little bit better view of this without the sun, and you're going to come here. And if I go into internal rotation, so that hip going out, foot going away from your body, or sort of away that way, right? You want to have at least 45 degrees of range out that way, as well as this way. So the rough rule of thumb, or rough kind of measure, is you want to be halfway to 90 on both sides. If you're that, you're probably pretty good at the hips, okay? You can always have a little bit more, but you're here. If I'm someone that's stiff right at that point, then I better work on this range of motion. If I'm stiff there, I better work on that range of motion. But you want to be able to get that foot out like that on both sides with that femur straight up and down. So that's your test. Now, let's say you're stiff into that externally rotated position. What you're going to do is grab yourself a ball and get into your bum part. So get that ball, sneak it into back here like this, okay? So you're going to get down on your bottom, get that right into the good stuff there on your back. Laying down, you're going to lay that hip back and forth into external rotation. Heel on the ground, rolling back and forth. Find a spot you really like or don't like. If it's uncomfortable, work it. If it's too uncomfortable, stop it, right? But you just keep going back and forth and just think of happy places, right? So that's number one, to loosen up the soft tissue in that range. Then you're going to come on up and get into a stretch. So then you're going to come down here, right? Get into that lunge position. Drive that elbow into the knee. Come into this sort of Hulk smash, sort of superhero position, and then drive that elbow out into the knee so that you're driving into that externally rotated hip position. You should feel this kind of open up all this business in here, right? So again, if I was in my bottom squat position, this would be one leg. I'm driving that out. So that's our external rotation. Now, to work on that internal rotated spot of things, we're going to get down and get into our TFL, called our tensor fascia lata. All right, so it's this kind of big muscle that sneaks down right where your front pocket is. Now, this muscle technically internally rotates the hip, but if we can loosen up this guy, we'll be able to better approximate the hip and the joint and get you some better movement. So get your ball to get in right here on your belly. Get some good pressure on it. You're going to bend your knee, and what I want you to do is then bring and twist your hip into that internal and external rotated position, and it feels wonderfully wonderful. Back and forth, back, up, and down, weighing around on it, and this spot can feel a little bit wonky, so if it feels weird, it's probably weird, but see if you can work that comfortably. Spend 2 minutes in this position. Once you've sort of worked on that, we're going to do something we call dead man's. Now, you got to imagine a wall here for this. And what you're going to do is the spot that the leg you're mobilizing, you're going to put up on a wall. Imagine this is pinned up against a wall. With your other leg, you're going to sneak over and twist it in. So now you're internally rotating that hip against the wall, and your hip is flexed at about 90 degrees, and you're going to twist that in. Make sure you don't fall your hip towards the middle, right? So you're here, you're twisting out, using your other leg and supporting it against the wall, okay? Hope you guys can imagine a wall sitting right there. Not too many walls around the beach here in Toronto, but that's all good. Now, last piece of this is we've kind of gone through, we've worked on our extra rotation of the hip, we've kind of opened up our inter rotation of the hip, and now we're going to activate this. So sneak on your band, around just above your knees. You're going to drive your hips out into kind of that normal squat position. You're in your ready stance. Now what you're going to do is slowly control yourself driving into internal rotation of the hip, and then squeeze your butt muscles and drive out into external rotation. So you can slowly resist, control that movement in, and drive out. Slowly go in, use that full range that you have, then drive out. And switch sides. You come in, bam. Come in, bam. And drive in and out. Okay? That's going to help you guys work on opening that thing up. So that's our fixes for that. If your rotation is a bit wonky, if it's your external rotation, you can get in the ball into your butt, then work on that lunge, sort of super smash, lunge, Hulk type position. Number 2, if it's your internal rotation, you're going to get into the front side of your leg, and then work on those dead mans against the wall, and activate all that business with the band. Okay? If you guys enjoyed that, please hit like below, subscribe to us, stay tuned for our next video, where next week we're talking about our ankle restriction in this, and finally, of course, don't forget, move like you mean it. Thanks a lot, guys.